he was, he raped a 24-year-old in December 2018. In October 2019, he was sentenced by the High Court, 8 years in prison. And then in July 2020, he appealed. And in September last year, his appeal got quashed. Now, the key thing is that between that time, between 2018 and September last year, and just last month, while he has been going through the justice system, the justice process, even after his conviction, he has continued to play rugby at local tournaments representing the Fiji Correction Service. Now, why this is a problem is because in Fiji has one of the highest rates of violence against women and girls, physical and sexual violence against women and girls in the world. So at least 1 in 3 women, face this very difficult situation of sexual and physical violence in the country. And so women's rights groups, the government, they have been saying that, it is a national shame. And so to allow a rugby player who is a convicted rapist to be allowed to get out of prison and play rugby and do what he loves to do, to enjoy, what he loves to do, it sends the wrong message to address this very serious issue that the country is facing.
Thank you for your time. That's RNZ Pacific's Kelvin Anthony. A suspected drug lord whose arrest sparked clashes in northeastern Mexico has been deported to the US. Juan Gerardo Trevino, also known as El Huevo or The Egg, was captured by Mexican authorities. A violent gunfight between the military and gang members ensued in Nuevo Laredo, a city on the Mexico-US border. A US citizen and on a wanted list, he is facing drug trafficking and money laundering charges in the US. He is accused of leading a powerful criminal.
Thank you for joining us and welcome once again to Tamaki Makaurau for another update on the Omicron outbreak here in the northern region, and we're coming to you today from just outside Middlemore Hospital. I'm Andrew Old, the Chief Clinical Officer for the Northern Region Health Coordination Centre, and I'm joined today by Dr. Vanessa Thornton, Emergency Physician and Clinical Director, Hospital Services for Counties Manukau DHB. Today we will provide the usual updates on case numbers and hospitalisations, both here in Auckland and across Aotearoa. I will provide some more detail on what we expect to happen over the coming weeks, and also an update on our work to understand the difference between people presenting for COVID as opposed to those presenting for other reasons who also have COVID. Vanessa will then give an on-the-ground view of who her teams are treating and the types of underlying health conditions which are making people the most vulnerable in this outbreak. But first, today's numbers. Today we are reporting 19,566 new community cases of COVID-19 across Aotearoa, with 4,867 of those here in Auckland. There are 930 people in hospital, 618 of those in Auckland, and 23 people are in ICU, 10 of those here in Tamaki Makaurau. We are sadly today reporting a further 10 deaths from COVID-19 in Northland, Auckland, Bay of Plenty, Hawke's Bay and the Hutt Valley. Our heartfelt sympathies are with the families who have suffered these losses today. Every death in this outbreak is felt by all of us working in the response. As always, further details on case numbers and those deaths will be provided in the Ministry of Health's 1 p.m. written statement. So we're pleased to see that case numbers in Auckland have continued to track down, which confirms last week's optimism that we have passed the peak for the number of cases for this outbreak in Auckland and expect this to continue to decline over coming weeks. We talked last week about the expected long tail of this outbreak and our concerns that this will start to impact on our older, more medically vulnerable populations. Although at this stage cases remain predominantly in younger age groups, we are seeing an increasing number of older people in hospital with severe illness, and it's important we remain vigilant to prevent further spread into groups who are at higher risk of ending up in hospital. As expected, hospitalisations remain high, with 618 people with COVID currently in hospitals across Auckland. With cases declining and new admissions plateauing, we're hopeful that hospitalisations too may turn a corner over the next week. The average age of people hospitalised in the northern region remains about 40 years old, with 20% of all hospitalisations in the last month in people over the age of 65, which represents about 8.5% of cases in this age group, compared to about 1.5% of cases overall. While the total average length of stay remains less than 2 days, for people over the age of 65 it is more than 3 days, which highlights the additional risks for older people. Now, there's been a lot of discussion about people admitted to hospital for COVID as distinct from people who are admitted for other reasons and have COVID as a secondary finding. As mentioned last week, it's very difficult to differentiate at a system level without reviewing individual clinical notes. So to inform our planning, that's what we have done over the last week. An initial case review of 400 admissions has found that about 1/3 of those clearly have COVID as their reason for admission. A further third appear to have COVID as a secondary finding, while a quarter were diagnosed with COVID during their admission, and at the time of the review, the contribution of COVID was unclear. The remaining 8% is made up of people for whom more information was needed, highlighting how challenging differentiating the contribution of COVID can be to any individual admission. So those data, somewhere between 30% and 50% of COVID admissions being for COVID, are very consistent with what we see overseas. So that's a good reminder that vaccination continues to be your best defence against severe illness and hospitalisation. With half our population now boosted, people who are boosted make up just 11% of hospital admissions. This compares to 18% of the population who are unvaccinated, remembering that includes all children under the age of 5 who can't yet be vaccinated, who together make up almost 37% of hospitalisations. As well as protecting yourself, vaccination is particularly important for protecting our whānau and community members who are at greater risk of getting very sick and ending up in hospital. Again, this includes our older adults and people with underlying health conditions like heart disease or diabetes, and again, those younger children who can't be vaccinated. If you have someone who is at higher risk in your whānau, there are a range of precautions you can take to protect them. This includes monitoring yourself for symptoms, and if you do have them, getting a test and staying away until you are well. Even if it's not COVID, you could still be passing on another illness. Wearing a mask, maintaining physical distance from others when in public places, and socialising outdoors or in places with good ventilation when possible are additional actions you can take to help protect yourself and those around you. The other point I want to acknowledge is that we continue to see pressure on our hospitals as our hospitalisation rates remain high. As we have previously outlined, staff are being redeployed across many areas to ensure that we can still provide a high level of care. Prior to COVID, DHBs in Auckland were already running about 15% under ideal staffing levels due to other issues, such as vacancies and unplanned leave. On any given day at present, we're seeing up to an average of about 10% further reductions in staffing levels on those already reduced figures across the region. This is not just because staff have COVID, but a range of other factors, including other illnesses and people who are off work caring for other family members with COVID. Again, I want to thank the entire workforce across the city for their huge effort in ensuring we can continue to maintain urgent care for those who need it. I'll now hand over to Dr. Vanessa Thornton to tell you what this means for our frontline staff. Vanessa.
Thanks, Andrew. Over the last couple of weeks, we're seeing about 30% of the patients arriving at our emergency department testing positive for COVID. Here at Middlemore, we have 5 wards dedicated to COVID patients, and like other DHBs in the northern region, we have deferred all clinics and surgery that are not time critical. Where clinics have been deferred, we've redeployed that staff and we're managing to keep our hospitals safe. Our community has responded to our messages to monitor their COVID symptoms, call their GP, medical centres or healthline for advice, and then come to the hospital when seriously unwell. As Andrew has said, we are seeing more medically vulnerable patients in the ED, and often it's the underlying medical conditions of these patients which are having the greatest impact and need for hospitalisation. Some of the prevalent conditions that I'm referring to are diabetes, heart disease, chronic lung disease. COVID seeks and finds the unvaccinated, so please continue to get your vaccinations across our region and get the booster shot. Isolate at home if you become unwell and seek the right medical advice when you need it. Thank you, and I'm happy to take questions later.
Thank you, Vanessa. So before we finish, I want to briefly talk again about testing, as it remains important in our response to Omicron. The results of tests continue to direct the actions we can all take to support our community, as well as providing important information about where we are in the course of the outbreak. A lot of people ask, why do I need to report a negative RAT result? While it's true that it's most important to register your positive RAT results so we can continue to ensure you get access to any support and care you might need, it's also important to let us know about your negative results. Put simply, this provides vital information about where we are at in the outbreak by helping us know how widespread testing coverage is. If we have an indication of how many people are negative, we can work out the trends of the virus and the care that might be needed into the future. This benefits every person, their whānau, and the community as a whole. While it's great to see the number of COVID cases decreasing in Auckland, we're not out of the woods yet. The risks of this outbreak remain high, and it's important that everyone continues to play their part. We are very aware of situations abroad where there have been resurgences of cases after a first peak. We've talked a lot here about the importance of getting your COVID vaccinations, but with winter now just around the corner, not that you'd know it today, it's important we don't forget about other vaccine-preventable diseases as well. If you're eligible, please get your flu vaccine when they're available. If you have children in the house, please check to see that they're up to date with their childhood immunisations to protect them against diseases like measles and whooping cough. And of course, if you haven't already, please do get vaccinated against COVID-19, including your booster. As mentioned earlier, we expect this outbreak to have a long tail, both for Tamaki Makaurau and New Zealand as a whole. Thank you to everyone for playing their part. Whether you're a healthcare worker taking on extra shifts, or you're someone isolating at home to protect your community, we all have our role to play, and I want to thank you all. With that, Vanessa and I are happy to take questions.
I've got a couple for Vanessa, first off, if that's all right. Sure. Do you happen to know what the longest stay for a COVID patient is during this outbreak?
I actually haven't got that data in mind, but I'm happy to look up that after this fact. There are people that have stayed a lot longer than others, so there is the short turnaround that Andrew has referred to, but there are people staying longer than 7 to 10 days. So I can confirm the exact data after this.
Can we talk to the treatment of patients who might stay for 7 to 10 days? How seriously unwell are they? What sort of treatments are you providing?
Well, as Andrew said, the people come in for a range of reasons. So some people come in with the underlying conditions. So we're obviously treating both the COVID and the underlying condition, like heart disease, asthma, and these sorts of conditions. So we use the usual medication to treat those. With respect to the COVID or the lung infections that you can get as a result of that, which we call pneumonitis, there are some antivirals which we use and some steroids which we use in the course of the treatment of COVID, and that has been the same treatment throughout all our COVID admissions in the last 2 years.
While it's treatable at home for the majority, from your perspective, how do you feel when people say Omicron's a mild illness?
Yeah, look, from our side, obviously we see the people that are sick in the hospital, and the numbers that have been reflected in our report today and during the week show that there are quite a few people who have been sick with that. So we do see the sickest of the people, and we know that people can get quite unwell with this illness, and that's why we're trying to recommend that people get the vaccination to help prevent people coming into the hospital as a result of it.
You've got 5 wards of COVID patients. I know you hoped it wouldn't get higher than that.
Yep.
Is that still manageable? Can you cope with more?
We can do more. We've got preparations and plans to increase to a further ward as required. At the moment, our numbers are staying around 160 inpatients, and we're just monitoring that on a day-to-day basis. But we do have plans to increase to a further ward if required.
Just on staff, and we had a report in the Herald this morning, including a pretty frank account from a nurse who's saying that we're exhausted. We're pushed to the limit at the moment. seeing that in your staff here at Middlemore?
Look, I think as Andrew has said, we've had a chronic shortage of staff, and this is adding a bit of an extra stress to that, and we know that the staff are really working very hard over this time, and we're doing as much as we can to support that. All the staff have been working for 2 years on the COVID scenario and are used to the COVID, but it's just the added stress of this on the underlying resource that we are below level on.
Do we have any COVID positive staff who are currently working as per the rule that came out a while ago?
We haven't got any today doing that, but we have the option to do that if we were to fall into more trouble, and that is because we have reduced the number of other activities we're doing so we can redeploy into the acute area and support our acute events at the hospital. We have not had to at our hospital to do that.
How many staff are down in the ED numbers today?
I haven't got the exact staffing, but we've had about 10% of our nurses and orderlies and clerks off, so that's across the board.
And what has been the worst day in terms of a rough percentage?
I think as a rough percentage we went up to 15%, but some areas have been more affected than other areas. We were much higher, for example, in our orderly team, which was very affected and is a reflection of our population.
What kind of impact does that have on how you're working and on the care that people get who are coming in?
Well, as I said, we've redeployed from other areas. So, for example, the allied health team has been very helpful to assist the orderly group to ensure that we maintain a minimum service in our orderly team.
So what sort of people from allied health, what are their normal jobs?
So, for example, for allied health includes physio, OTs, these kind of workforces that have assisted us, pharmacists. That's what we called allied health in our hospital.
And do you have a sense of whether the staff absences are sort of plateaued or whether there's a sense that we're having fewer staff absent?
I think we're at a steady state, and it's the same with the patients, because remember, our staff will get the COVID in the same way as the community does. So what we see in the hospital is staff getting COVID in the community, and that's a reflection of the hospital population.
Just lastly, can you just give me an example of how, say with a doctor's job, how that changes having nurses or orderlies or fewer nurses or fewer orderlies?
Oh, I think, as has been stated, it's caused a lot of stress on the system, but and we've had staff come and assist in the emergency department that are not usually working, and we're very grateful for those people. But it just adds some extra work to our work. But most people have been really very helpful in this scenario.
You mentioned pressure on staff the last 2 years. What does support look like for them? What's been offered?
We've had a range of things implemented in terms of that, and I think Andrew has some more data on the staffing initiatives, but we've provided a lot of support in terms of even just simple things, meals and things like that, snacks to enable people to have a bit of a break and a snack in the area which we would not normally provide, and also other financial enhancements that have been in place for the last 2 weeks where the staff have been mostly affected.
When the government starts to talk about changes to our response, like potentially moving Auckland into level orange and also opening the border to tourists from around the world, does that make your heart rate go up a little bit in terms of what might be happening in the hospitals in the coming weeks?
But I think, as Andrew said, we're moving into winter, so there's some other illness that will become part of what is our usual winter that we normally get from overseas, for example, RSV. So we will be starting to prepare for winter in a usual sort of way, with diseases coming from overseas into New Zealand and a community that's been locked down for the last 2 years, with a lot of isolation. Hopefully all the practices that we're doing with hand hygiene, getting vaccinations for flu and these sorts of things will help prevent that.
Would you prefer that the country keep its borders closed until your staff have had a chance to get back to a normal state of affairs, recuperate a little bit, and then they could tackle winter and what the rest of the world will bring?
Look, I can't really comment on that, but with respect to the staffing, we've had this chronic shortage. In some ways, we may get more staff coming in with, coming from overseas to New Zealand, which has been restricted. So it's a double-edged sword. But in terms of more disease coming, we will be expecting people coming across the border with that.
I've got a couple of questions for Andrew.
Yep.
That's all right. Sorry, Dr. Old. turnover. What does that number actually mean for the region? Because it's not actually possible to get 100%.
No, you're right. It's not possible to get all the way there, we don't think. But certainly, the fact that we can get our population very, very close to 100% vaccinated really will help, and is helping, with us being able to bring down the cases in Auckland that we're seeing at the moment, and will really set us up well, we hope, for winter, which we were just talking about just before. So I think if there's fewer people who are unvaccinated to put real pressure on the health system, we know that people who are vaccinated, even if they get infected, they are less likely to pass it on than people who are unvaccinated. So all of those sorts of things mean that a very highly vaccinated population really puts us in a good place as we move into the rest of the year.
Just on the $500 bonuses for nurses and other staff that the Herald reported this morning, is that going to be extended? Because I understand that that's stopping this week.
So I can't comment on the extensions specifically, but I think, as Vanessa said, those were additional payments that were put in place for a particular 2-week period to cover really quite extreme circumstances. So as we talked about last week and this week, we've got significant staff shortages, we've got a lot of reduction of services, we've got people working outside their usual areas. So it was really a way to focus particularly on those critical, otherwise hard to fill shifts, so particularly focused on overnights, and as a recognition that, as Vanessa said, for 2 years we've been asking people to go above and beyond, and now we're asking them to go above and beyond, and so that's really, it was a recognition of that.
Yeah, but you must be able to speak to whether that's something that you're thinking about continuing, because obviously, as we've noted, that things are going to keep getting harder and harder.
So I think those sorts of things are, and the reason it was put in for 2 weeks was they are reviewed regularly about whether there is an ongoing need for them. As I said, we are plateauing with our hospitalisations now. Our number of cases who are staff seems to be starting to come down in line with total community cases. So over the next week we would hope that the situation would start to ease and the need for those sorts of incentives may reduce. But as I say, they're being reviewed by the hospital teams on a near daily basis about what's required to help keep the providing safe urgent care for people who need it.
Specifically will be reviewed to see whether it's needed.
Yep, so it's ongoing review.
One for a colleague. What concern is there about Māori representing a quarter of all COVID-related deaths? Particularly, there seems to be quite a number. I think it was 13 in the 0 to 59 age group as well. What concern is there for that, and what is being done to reduce that?
Yeah, so I think obviously every death is a tragedy, and we know that because the outbreak started here in Auckland, that cases and hospitalisations and sadly deaths do reflect the makeup of our community. So about 60% of the community here in Counties Manukau is either Māori or Pacifica, and unfortunately we know that across the board Māori have poorer health outcomes for a wide variety of reasons. So we are working very hard with our Māori and with our Pacific community partners to get vaccination coverage up, because vaccination remains the single best thing we can do to prevent people from serious harm. And then once people are in hospital, providing the best care that we can. But as I say, the single biggest thing that we can do to prevent Māori, Pacific and others vulnerable groups from having severe outcomes is to support those communities to get vaccinated.
Just a follow-up question on the 100% vax for one of my colleagues. So the 100% vax, does that give the community a false sense of security?
I think what we've seen with Omicron, which was different to Delta, is that vaccination doesn't stop you necessarily getting infected, but it is very, very important for preventing severe disease. So I think there possibly is an element of complacency about that, which is why it's really important for people to maintain other protections. So at the moment we're talking about continuing to use masks, be mindful of symptoms, because just because you're vaccinated you may still pick up COVID and pass it on to someone who is more vulnerable, either in your family or someone that you might meet. So I think while it's fantastic that as a country we have done better than most places around the world, in fact, it certainly is not. It's not a silver bullet. It's not magic. So we need to remain vigilant. And I would just say, as an example of of the power of vaccination is if you look at what's happening right now in Hong Kong as an example. They had a similar elimination strategy to New Zealand. They managed to keep the virus out for a similar length of time and then caught an Omicron wave at about the same time we did. And they have now the highest death rate in the world pretty much at any time over the last 2 years, because about 2/3 of their older adults are not vaccinated, and it's really showing the importance of vaccination.
And for our young people who got COVID before they were able to get their booster, and now they have to wait 3 months to get their booster, are they considered, or should they consider themselves fully vaccinated? What's the terminology we should use there?
No, I wouldn't say they're fully vaccinated, but we know that if you have had 2 doses of a vaccination and then you get infected, that gives you a level of immunity. And part of the reason, as Dr. Jordan spoke to last week, for delaying the booster dose is to really to get the best mileage out of that booster dose, to give you your immune system time to get back into a place where you're going to be able to get the most benefit. So no, we don't think it's as good as having a booster on board, but it certainly provides a level of protection. Of course, the counter to that is you don't go out to get infected in order to try and get immunity. So it's but if you are in that situation, then it does provide you a level of protection against future infection. Yeah.
How confident are you that we have passed
So last week I overused the expression cautiously optimistic. I would say today that's been replaced by a sense of relief. So I think we now have enough data for Auckland. And as I said last week, we are still seeing good numbers of tests being registered and a number of people across the district to be reasonably confident that it is a true reduction. So I think for Auckland, yes, I'm confident that we are now coming off our peak. Obviously the rest of the country is a little bit behind us.
How many nurses have taken up that $500 bonus?
Oh, I don't have that information. No, I think we'd have to, yeah, we might be able to come back to you on that one.
Yeah.
So, yeah.
Also, just if that sixth COVID ward has to come into being, I don't know if we could who answers that, what specifically will be cut back to allow that to happen? What is there left to cut back?
I think if we need the sixth ward, it's about a balance of patients. So we will still be catering to all the need. It's just that we will convert a ward with the infection prevention control strategies that are required for the COVID. It means there's more patients within the hospital as a percentage that have COVID. So the staffing has already been enabled because they're already looking after patients. It's a conversion of one ward to another. And making that with all the IP&C, which is infection prevention control procedures, to enable that. So it's a different type of ward in the way that we work.
So I just don't understand if there's a certain amount of staff needing, of patients needing non-COVID care now, wouldn't that stay the same even if no one COVID?
So I think what that's related to is the fact if the percentages stay the same, the length of time that's required and the presentations. So we will just need to make that balance, if that makes sense. So it's sort of a balance of patients in that arena using those IP&C procedures.
Dr. Thornton, do you think that $500 bonus should be extended to your staff?
Oh, look, I think as Andrew said, it's in consideration as we speak, and it's a matter of watching what the peak is and what the numbers are and what's happening in the positivity rate in the staff in each division. So I understand it's been considered, and people are thinking about that, and that's what we need to do on a week-by-week basis.
But personally, do you have a view?
We need to fill the out-of-hour shifts, so I think that's a useful thing to do to assist, but it doesn't solve the whole problem because there's also a 24-hour day, and so, we need staff at all times. The nights are just less popular, as you can imagine. Yep.
Those who are in hospital and having quite severe conditions and are staying for longer, are you able to speak to the proportion of those who are not vaccinated and maybe how their condition is different possibly to those who are vaccinated?
I'm not sure if we've got the data on the unvaccinated rate, but I know that more of the unvaccinated patients go into the intensive care unit. But their condition is more severity of illness in combination with their underlying conditions. So they're more likely to get the things like the pneumonitis, which I referred to earlier, and they stay for longer within the hospital.
Are you noticing any trends, just to follow up, are you noticing any trends between common underlying conditions and those who are ending up in ICU unvaccinated?
Oh, no, it's a variety, but most of the ones that are in ICU for COVID is related to this pneumonitis, which is the oxygenation of their lungs, and COVID can cause reduced oxygenation. And that's the cause of the reason why they're in the intensive care requiring such high amounts of oxygen. They come in for the other conditions, of course, too. That's the... Thank you.
Thank you.